Thank you all for your patience. Good afternoon. It is Wednesday. Thank you. It is Wednesday, April 8th. You are in the Senate Finance Committee. We are going to start voting with voting list number 27. And now that my vice chair is here, we're going to start with vice chair's bill, Senate Bill 279. And Amber.
Thank you, Madam Chair. Senate Bill 279 generally authorizes an enforcement officer of the Tobacco Use Prevention and Cessation Program in the Baltimore City Health Department to enforce certain titles of the business regulation article, including Title 16 pertaining to cigarettes, Title 16.5 pertaining to other tobacco products, and Title 16.7 pertaining to electronic smoking devices. An enforcement officer may enter and inspect the premises of a license holder at a reasonable time, and the Alcohol, Tobacco, and Cannabis Commission may reprimand, suspend, or revoke a license for a violation that's identified. Additionally, the bill requires an applicant for a tobacco license to provide the court clerk an approved licensure authorization along with the application and license fee. The bill also authorizes the Baltimore City Council and the mayor to establish a process to accept and approve or deny the licensure authorization request. And finally, the bill establishes a one-year moratorium on the issuance of licensure authorizations to be issued for applicants for a new license or initial license specifically. The First Amendment was, you have a reprint, which alters the bill as described. It's quite a bit longer because we had to put things into all of the different titles, 16, 16.5, and 16.7, which has added to the length of the bill. As amended.
Okay. This is a local bill, so we need to call the roll. Tammy, can we call the roll, please? No, Senator Mouth's your
The
question.
bill that changes the tobacco regulation from statewide to giving the authority to Baltimore, is that the bill?
It gives a limited amount of authority to Baltimore City to regulate certain titles of the business regulation article, but ATCC is still also able to regulate those titles.
Okay, all right, thank you.
Senator Hershey?
Thank you, Madam Chair. So just maybe the sponsor or vice chair, just why was this necessary again, going back, and why are we giving this type of authority to a city where, you know, municipality government, when I don't think we do that really with anyone else?
Yeah, so actually, all of our local jurisdictions, including Baltimore City, which happens to be the oldest health department in the country, had this authority up until, I think it was like 2003. I forget the exact date, but in the early 2000s, when the Atatis decision was made in Prince George's County, where the courts ruled that anything related to tobacco was reserved at the state level unless the state expressly expressed this. But prior to that time, local governments all around the state of Maryland was passing laws and legislation as it relates to it. So it's not something new. It's just reaffirming the local authority in local communities around tobacco.
Right. Well, it might not be new. It was in place for a while. Then it left all the local governments and went back to the state, right?
Because of the court challenge.
Right.
Correct.
But now this is essentially bringing it back to the local level.
Correct.
And like I said, but are there other counties that we're doing this for as well too? Or is this just strictly? Well, that's where my next question was going. Thank you, Senator Kramer. I mean, are we then opening this up and saying, are we going to see this,
Yeah,
so with everybody now
Right.
and cite the same things that you're citing and say, well, we used to do it and we didn't, but now we're going to do it again?
Yeah, I think you heard at the hearing that local communities are in the best position to determine what's best for their jurisdiction. In this case, this is a local Baltimore City bill, and Baltimore City, and there's been other cases where because we're the oldest health department in the nation, things like loose cigarettes or whatever that we've already given the city the authority to attack. ATC has a limited amount of resources, although they would still have the opportunity to enforce. Having the force multiplier in the health department gives us a better opportunity to regulate it. Again, you remember in the testimony, there's places in Baltimore City that have 4 or 5 tobacco shops in one city block, right? We probably definitely have way more tobacco shops than we have recreation centers and opportunities for young people. And so we would like an opportunity as a city, similar to other cities like Ocean Cities and other has done, to have a better control on what happens as it relates to tobacco in our city.
Okay, so enforcement being one thing, what about authorizing the licenses? Is it still the city and the mayor to do that? Or was that amended?
No, so the licenses are issued by the clerk of the court. This would be a pre-authorization before it go to the clerk of the court. Pretty much anyone that come to the clerk of the courts and have the right amount of money can get it.
Okay,
Anybody. And that's why you have situations where you have 5 in one block, because, anyone can do it. And what we've heard in a testimony, not only are they, in many cases, selling tobacco, they're also selling many of the things that we have not regulated, and that's, and in some cases, yeah.
okay. Thank you, Vice Chair. Thank you, Madam Chair.
But also to your point, Senator Hershey, Baltimore City isn't the first, we're not the first one to have this pre-authorization. I believe it's in Ocean City, they have this prior to what we had. Yep.
Tammy, let's call the roll, please. Oh, I'm sorry, Senator Washington.
Okay, Madam Chair. Thank you, Madam Chair. I think it's a great bill. We've seen these, smoke shops and all types of tobacco stores in Black communities a lot, and they proliferated through our city or even my county. I remember seeing a fiscal note and even some information from ATCC around these stores, and it said that they were mostly in Baltimore City and Prince George's County on a higher level. And so I wish our county had something similar to this that would have them to be able to regulate these, because we've seen a proliferation of them in Prince George's County so many different times that we can't seem to control it and where they go and who they are, because they bifurcate the county laws or even the state laws to get these types of permits. So I think this is a step in the right direction, and it is a local bill, and I will be supporting this bill for those reasons.
Thank you, Senator. I do think we helped a little this year with one of the bills we passed for ATCC, because a lot of it is the smoke shops are selling some illegal products, so there'll be more enforcement. Yes. But there's an idea for you for next year. Thank you, Senator. If there's no other questions, we're going to call the roll.
Senate Bill 279, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
Yeah.
Yes. Senator Mounts.
Yes.
Yes. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey.
I'll admit I am concerned about this, but I will say that it is a local bill, and the vice chair's made a good explanation for it, but I'm concerned that we're going to see this a lot more often. So, yes.
Next.
Madam Chair.
Yes.
Yes. Unanimous. 10-0.
It's that 10 to 0. Now, please bear with me today, because we're not going to just go straight down the list. There's some requirements that we vote bills that have cross files and bills that don't have a lot of amendments and discussion. So I'm going to move around to get as many bills passed as we can. The next bill is House Bill 191, Delegate Wims. I think there was maybe an amendment proposed. Amber?
Correct. So this bill was on the list yesterday, and it came to the committee's attention that there was an amendment, a sponsor amendment on the bill that was missing or wasn't on the bill. That has been fixed. Just as a reminder, the House Bill 199 establishes that for certain transactions for essential consumer goods, a merchant may not prohibit a person from using cash, require them to use a credit or debit card to purchase, or charge or collect a higher price than collected for an equivalent cashless transaction. The amendment on the bill from yesterday is still there, which provides an exclusion for fuel that is purchased through a paid membership is not required to accept cash, as it's not just open to the public. You have to have the membership first. And then to make sure that this bill does not conflict with the penny rounding bill, on page 4 after line 13, there's provision just making it clear that a merchant is authorized to collect an additional amount not exceeding 4 cents when rounding pursuant to applicable law.
Any questions on House Bill 191? Senator Hershey.
Thank you, Madam Chair. I wasn't sure if this got brought up yesterday or not, but was there a concern about having to accept cash at certain hours of the day or the night? For instance, if a business decided that they don't want to be dealing with cash certain hours of the day?
I did not receive any amendments or testimony on that point. And we have accepted the amendment from the Retailers Association, who was unfavorable on the bill. That would make them neutral on the bill.
All right. Can I just check that out, Madam Chair? It'd be okay to hold this and find out if that's it. You know, obviously there are certain businesses that just certain time of day, or, you know, don't want to be dealing with cash or don't want to be in a position where a lot of cash is available. So if I could just check on
You may
that.
hold the bill.
Thank you.
The next bill was asked to be held for an amendment, and the senator that asked for the amendment isn't here today, so we're going to hold it again. That was 564. The next bill is the administration's land use bill, transit-oriented development, and again, Amber.
Nathan's going to be coming around with an updated reprint on this bill. Oh, wait, no, sorry, that's, never mind. Sorry, you should have a reprint already, right? But, sorry, still pass it out, but it's for the next bill.
Okay. So we
Yeah,
want
we're just
yesterday's-
moving quickly.
We want yesterday's reprint of 894, right?
Yes.
Okay.
Okay, so this bill was held yesterday by Senator Hayes, who I believe has had his questions answered, but just for the committee's edification, again, House Bill 894 is an administration bill that, as amended, is substantially similar to Senate Bill 389 as it passed the Senate unanimously earlier this session. In general, the bill makes several changes to the state law related to transit-oriented development, authorizing the Maryland Department of Transportation to lead development and planning for projects on land that is contiguous to certain rail transit stations owned by the state, Baltimore City, or Ramada. The bill also authorizes the designation of a TOD as an enterprise zone, restricts local land use authority as specified for TOD projects, and generally requires that excess taxes and impact fees be collected at the end of a project as specified.
Senator Hayes.
Thank you, Madam Chair. This morning, I had an opportunity to meet with Drew and Matt from MDOT, and I'll tell you, I'm very appreciative of the meeting that I had. They were very informative and helped me to, truly understand and answered all my questions to my satisfaction. So I just wanted to publicly say thank you for taking the time out and explaining this to me. I understand a lot better. I know our colleagues in the minority party have different concerns than what I had, but I just wanted to express my appreciation for the folks over at MDOT for took the time to meet with me. Thank you, Madam Chair.
So are you going to make a motion?
Yes, I make a motion favorable for House Bill 894
As amended.
as amended.
As amended. Senator Carter, Senator Reed, you have a second?
No,
Let me get a second. Senator Jackson seconds it. Okay, go ahead.
Thank you, Madam Chair. We heard from some, I don't know if you call it testimony since it was in a voting session, but that this is the issue of the project labor agreements being the same as the executive order. The governor's executive order applied to large-scale public work contracts. This bill, as written and amended, would apply now a project labor agreement requirement to grant programs like the TOD Capital Grant Revolving Loan Fund, or let's put it this way, it would give a leg up. If you're applying for these funds, and you're supposed to be applying for these funds for planning purposes, generally speaking, this is going to put in place, this is not the governor's executive order, this is beyond that. The governor's executive order was for large capital projects. And quite often, frankly, based on the information I've found, they've had to waive that requirement to try to get things underneath certain requirements. Not always because of cost, although cost is a factor, but often because of it can be workforce issues as well, but not to get in the weeds. But basically, this is not, the House amendment goes beyond the scope of the executive order. It applies to grant programs and not just public works projects. So I mean, I don't know if council, am I wrong here, council? That's kind of what I've discovered.
You're not wrong. The executive order is for large-scale public works contracts. The administration is committed to using the PLAs as a prioritization. But in this bill, the PLA provision is added as a criterion for consideration when a local or developer applies for grants or loans from the Capital Grant and Loan Fund only. It doesn't require that that project have a PLA, but it does give them a prioritization preference.
Right.
And the PLA provision does not require TOD projects that the state or the local work on to have PLAs. Doesn't require the locals or developers to include PLAs in their project.
It doesn't, but it gives them a significant leg up in a competitive situation. And my understanding, too, is that you don't generally do PLA work for, and I may not be using all the terminology right, but you don't generally, union trades are not home builders, generally speaking. I'm saying they sometimes do it. I'm not saying they can't or they don't, but generally speaking, union work is for these large capital projects that are state funded, county funded, whatever. So this is really widening. And the other thing is the governor's executive order, because I've looked at the language, it actually had some things that said it shall be made only where such an agreement will advance the state's interest in cost effectiveness, efficiency, quality, health, safety, et cetera, et cetera. The amendment from the House doesn't have any of those provisions in for a substitute or putting these grants. If the goal is affordable housing, and this is trying to put affordable housing near transit, which again, let me say, we had a unanimous vote out of here. We all voted for it. To then subject planning funds to a PLA, maybe not requirement, but it's like, hey, I'm concerned about that. I had an amendment I was trying to get drawn up. I don't know if we have it, but I don't think we want to keep that language in there.
Senator Hershey?
Thank you, Madam Chair. I would agree with the senator. Again, I go back to the bill hearing where the governor did not even mention project labor agreements when he came to testify in this committee. My assumption then meant that that wasn't necessarily a priority. I mean, I'm sure he was very well versed on what to say and how to present that bill when he came here. And I think he, with all due respect, he did a good job doing that. But he did not mention project labor agreement. It was not an important part to him. And when you talk about preferences, it's interesting as you look at the three other preferences. One says that it's going to enhance something, enhance access. Another, enhance something. One, encourage. This just simply says use a project labor agreement. It doesn't even tell you if that's a positive or not. I don't know if that's a positive. I just know that it makes the project more expensive, and therefore maybe they need the grants as a result of that. But at the same time, if we are looking at kind of trying to maintain costs and doing things in a cost-effective manner, I don't know why we're putting a priority in here that just makes projects more expensive. It doesn't change the quality of a project. It doesn't make it any better going forward. It just makes them more expensive. And we've all sat here in this committee for years and years and years and recognized that that's what project labor agreements do. So I would just say that, again, this bill without that language, I think goes the same way as what we saw when we first passed this bill out of the Senate. I mean, that's what we did. We passed it out of the Senate without this language, and everybody was okay with it at that point in time. And now all of a sudden the House says, oh, we don't like it, and we're going to come back and we're going to make it. The governor's office isn't saying that they need it in there. It's the House saying it. And from that perspective, I think that we should stand with what we put forward the first time. And, make the House come back to us every once in a while and say that they agree with us rather than us agreeing with them all the time.
Who's here from the governor's office? Drew, I know you're here from MDOT. Is anybody here from the governor's office is safe here? Ah, safe, thank you. I didn't see you hiding in the back.
That was the point.
Can you comment on this amendment from the House, please?
Thank you, Madam Chair. For the record, Safety Hill, Deputy Legislative Officer for Governor Moore. To clarify what the council has said, this is as a criterion into the TOD grant and loan program for locals or developers when they're applying for an additional fund for their TOD pieces. It does not necessarily mandate it, and the language is specifically on page 17, I believe line 7, it says or. So it doesn't require that you shall have a PLA for your projects to be applicable for the grant or the funds, but it simply states that this could be a part of the scoring mechanism.
Just if I could follow, it doesn't say not can it be just part of it. It says actually you get a preference if you use that, meaning it's a benefit to your project if you use project labor agreements. And that's what we're trying to say. If we want to do these cost effectively, should a project labor agreement really come into play? Is it necessary? And again, with all due respect, this was not mentioned by the governor when he came into the committee and presented the bill. So we're just, at least I and I think a few of us are trying to find out why this has now become a priority, especially since the Senate has already passed this bill without this language in it.
Sure. Thank you, Minority Leader. At the end of the day, and I would defer to this as the committee's bill, right? Whether it's the Senate's version of it or the House version of it, right? Whether the PLA provision is staying in the final version of the bill itself, I will say that project labor agreement has always been a commitment to the administration. That is why the governor signed the procurement guidance that is highlighting for project labor agreement for state-funded large-scale projects.
Right. And I can understand that, and that's certainly his prerogative to do that through executive orders. But as was mentioned yesterday, this obviously puts it into law, for any governor, that precede him. But thank you very much.
Thank you, sir.
Succeeds him. Thank you, Madam Chair.
Senator Kramer's next.
Thank you, Madam Chair. And, to be honest with you, I think we're hearing the typical disinformation about project labor agreements and what they do and the consequences of PLAs. The fact of the matter is PLAs can very often typically prohibit strikes, lockouts, work stoppages. They help, in fact, keep projects on schedule, which then, in fact, can reduce costly delays. They do help to standardize wages and benefits, and they do rely often on union apprenticeships, which actually does help bring very skilled personnel to the project, which again helps facilitate a timely project, a project that's kept on schedule, a project which can help minimize injuries on the job site. They usually have clear grievance and arbitration procedures, which also allow a project to move along in a timely fashion. So there's a lot of benefit to PLAs to provide predictability, which then ensures a project does stay on schedule, stays on time, and we know time is money. So I have no concerns with the prospect of the language as it is in the bill with regard to the project labor agreements, and certainly understand the benefit to the project with a PLA.
Thank you, Senator Kramer. Senator Reedy?
Yeah, so I mean, just again, coming back to what was stated in the previous time we've had this voting session now. So this is a dramatic expansion of requiring PLAs even for some, or giving a large preference to people who will put a PLA in just for planning funds around projects where we're trying to plan for more affordable housing. And I looked up, got some interesting information, a report that was done in Los Angeles. They've required a lot of these PLAs for any kind of housing of affordable housing projects, it's added between 12 and 21% to the cost. And actually, talking about keeping it on time, it takes longer because you have to, it limits the bidders, but completion time can take longer because you have to find workforce. And quite often on PLAs, another thing, you'll have a lot of out-of-state people coming in to work on the project because they have to all be union. And so we're not here to debate PLAs. PLAs can make sense, certainly in specific projects. But they also have pluses and minuses. That's why there's an industry that's union and an industry that's not, and they work oftentimes hand in hand on different things for different reasons. The governor's own executive order gives some caveats to the PLA requirement to say, hey, you got to make sure it makes sense financially, make sure it makes sense for a whole number of reasons that are in the best interest of the state. Now, in an area where we've said we need more housing, we need more affordable housing, and nobody in this committee or this Senate anyway disagrees with the idea that if you're going to prioritize housing, high-density housing, you should start with transit areas. Makes total sense. And now we're going to put a PLA on grants for planning? Like a requirement just doesn't make sense. So I just think it's not what was presented, and we should strike that language out and have a discussion on this, because I don't believe the administration really cared about this. I think now they're going to back it up because the House said they wanted it, and I don't think the House really, I just think it's a mistake to have that in this bill. So I'd like to amend it out. I don't know how I thought I had an amendment submitted, but I thought my staff had sent an amendment in.
Did you ask staff for an amendment, or to go through the amendment office?
I thought we went through here, but if we didn't,
Okay.
it's literally just striking that requirement out. I mean, it's not a, yeah.
I do want to go back to a couple things you said, and just to say this is not a requirement. It does give extra points, in consideration, but it's not a requirement.
Right.
Senator Hershey?
Fair enough.
Last comment before we make a decision here.
Thank you, Madam Chair. Just to back up the minority whip there, that is this bill any different other than this language than what we sent out? So in a sense, would we be able to just pass this in the exact other way that we?
There were a couple technical changes, but otherwise the bill conforms to the Senate bill as it was passed out, but for the PLA provision.
So that was my so thank you. So in other words, we could just vote to pass the same bill that we've already passed out with the conforming changes. Madam Chair.
And go to conference.
Yeah, I think that's the way to do this, to be honest. Again, this just goes back again to the Senate and the House and the battle that we're going to have over the next 3 or 4 days, but continues to be, are we always going to say that, we're going to take the House's product and not our product, especially when you get bills that come out unanimous. When this left this committee, everybody was okay with this language not being in here. Everybody was fine with that. And we got to the floor and there was no argument, and it came out unanimous because, in reality, there are a lot of good things in this legislation, and we've made some changes to make it even better than the way it was introduced. And then we took out one language that just gave a preference to something. You can still put in, all these projects can still have project labor agreements, but just don't give them a preference over another group that's competing for these same projects. So, Madam Chair, I know you've got a motion, and
I'm gonna hear from Senator Mouth,
Thank
and
you.
then we're gonna take a motion on whether we should make a change.
Thank you.
Senator Mouth.
I've been kind of quiet on this discussion. We're the second day talking about it. I just, and it's the same argument. It's just from a different perspective. I don't know why we would, I get all the arguments for PLAs, but I don't know why we would automatically put it in law that they would be ahead of the others. Why not just keep that? And there's nothing that would keep PLAs from getting this work. It just says, it keeps options available, because you don't know how all these different situations, what's going to come up. And I just think that's a different way to look at it, as opposed to, we're talking about taking that out. It's not taking them out. They're still probably going to get a majority of the work, but it provides that opportunity moving forward and not locking us in. And that's why I think it's really important that we stick with the original version that we approved. So.
Thank you, Senator. I think we had a motion and a second. Can I have the motion and the second withdrawn?
Withdraw the motion.
And then there was a second? Senator Jackson, will you withdraw your second? Yeah. Okay, so I'm only doing that because I want to see if there's a motion to remove number 4, which is line 7 on page 15, right?
Yes, we would strike lines, the whole article, transportation article, that whole thing would come out because we wouldn't be altering that part of the law anymore.
Okay, so that was existing law. Okay, so,
Most of it's existing law except for adding project labor agreement, so everything can be struck and it wouldn't change current law.
which would then be most similar to the bill that we passed from the Senate. Okay. Is there a
This would force us back into a conference.
it would force us into conference. An opportunity for conference. Okay.
The House could accept ours.
I know all about it. Who made the motion?
Hershey.
Hershey made the motion and Senator Mount seconded. All right. Should we just, all in favor of, you want a roll call?
Oh, I don't care whether it's roll call, but it's not unanimous.
Okay, so we'll do a roll call. Tammy?
House Bill 894, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Wait a minute, whoa.
We're just voting on the
We're
amendment.
on the amendment.
Oh, we're just doing the
Yeah,
amendment?
the amendment.
Oh, I'm sorry.
That's okay.
Okay.
And the amendment is to strip out the PLA provision.
Yes,
Correct.
yeah. The forced conference, yeah.
Okay.
I don't want to spend days on this. We're now on Wednesday with 3 days to go, so I'm just trying to get it moving, so.
Senator Reedy?
Yes to the amendment.
And I was
Yes.
no on the amendment. You got that?
Senator Kramer is no on the amendment.
Yes, no, yes.
I think Tammy's doing a good job of counting.
It's okay, I'm the whip, I did the vote.
Would you like me to start over? Okay. Senator Mouts?
Yes.
Yes. Senator Jackson? Yes. Senator Washington? No. Senator Guile? Yes. Senator Lamb? Senator Lamb, no. Senator Hershey? Yes. Madam Chair?
Yes,
Yes. 7-3.
now we need, do we need roll call on the bill with that amendment?
Move the bill as amended.
And that would be, just to be clear for the record, that would be as in the reprint with the technical changes, but striking the PLA in addition.
So it's still with an amendment, okay.
Yes.
Okay.
I move the bill as amended.
Okay. Do we have a second?
Second.
Okay. I guess we'll do a roll call.
House Bill 894, favorable with technical amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
So striking the PLAs is considered a technical amendment? or
There's
there's
other
just-
minor technical.
No, there's other technical amendments.
Okay. Yes.
Yes. Senator Reedy?
Yes.
Yes. Senator Mounts?
Yes.
Yes. Senator Jackson?
Yes.
Yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey? Yes. Madam Chair?
Yes.
Yes. 10-0, unanimous.
All right, we'll figure out who's going to serve on that conference committee. Okay. And here's another good bill.
I want no parts of it.
House, okay, let's get back to work. It's
895.
3 o'clock. House Bill 895. And again, it's Amber.
I believe this is the last one for today, for me. You should have a reprint. It's the one that Nathan was passing out during the discussions for the last bill. House Bill 895 is an administration bill that, as amended, prohibits a food retailer or a third-party delivery service provider from using personal data or engaging in dynamic pricing to set a higher price for food items. So that is the primary difference between the House bill and the Senate bill is the House bill has set a price and the Senate bill had increased a price. the compromise language is set a higher price for food items. The bill defines dynamic pricing as the discriminatory practice of offering or setting a personalized price for a good or service that is specific to a consumer based on the consumer's personal data. The bill also, as amended, defines protected class data and prohibits the use of such data in a manner that would that has the effect of withholding or denying from a consumer an accommodation, an advantage, or a privilege provided to others. Finally, a violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act, subject only to the civil penalty provisions and subject to a right to cure. So on the reprint that you have here, there are several amendments largely conforming this bill to Senate Bill 387 and make some additional changes that were from stakeholders and developed in concert with the administration. The changes today primarily appear on page 4. Forgive my notations. I was marking this up about 2 minutes before voting started. So at page 4, you'll see there is a definition added here for protected class data. That references to another provision of the bill where protected class data is used as a term, but it's not defined. Maryland Retailers Association and others were adamant that they needed that a definition was needed, so that's been added, and the administration was in agreement with that. The food delivery service, third-party, the providers, we've struck the term food from third-party food delivery service provider, just to clarify that they are delivery service providers. They can deliver other things besides food. That was requested by the third-party delivery services. And then as noted in B1 and 2, this prohibits a food retailer or third-party delivery service provider from engaging in dynamic pricing to set a higher price for food that is exempt from the sales and use tax, and to use personal data to set a higher price for food that is exempt from the sales and use tax. At page 5, there was some additional language added on in the House that has been struck from this bill. And otherwise, the bill conforms, except for as noted on page 4, conforms to what was passed out of Senate Bill 387.
Senator Hershey, do I see that light coming on?
I just had a question on it. Is that all right? Amber, thanks for all your work on this, but obviously there's been a lot of talking points on what is being accomplished this legislative session, and this is being touted as reducing costs for consumers. Is, you know, with all of these amendments, you just kind of start to find out what is the takeaway from this? What have we really accomplished with this bill now that we've made so many amendments? Is that something that you might be able to help us with, or we still have to decipher that ourselves?
Is that a 2 minutes explaining for
I mean, I don't mean, I hate to say I don't know what this bill does anymore, but it has been amended pretty dramatically, but it's also very different than what we've heard the talking points to be. So I want to make sure, are we truly doing something that we could all go back and say, you know, we were here and we've looked at affordability and trying to reduce costs for consumers. Does this bill really do that, or is this bill, as we said before, a solution that's looking for a problem?
So if I can answer one of
Yes,
your
please.
questions, Senator Hershey. Part of what we're striking is the House tried to add another bill into this bill. And so a lot of what we're striking is taking that additional bill out.
Right.
And trying to keep it to food delivery, but I guess you can call DoorDash and have cleaning supplies delivered. So, you know, I think that's why they struck food. So it is overall the same bill. I personally had issues with them just saying set a price, because you could be setting a lower price. which is a good thing for consumers. So we went to, they can't set a higher price. So we're hoping that flies. Again, it might not. We may end up in conference on this one. I do want to give Amber a shout out for the work she's done on this bill.
absolutely.
It's been tremendous. And she's worked with the retailers and she's worked with a lot of other, businesses to try to get this to where it's a good bill. So I hope that we can.
No, I
but-
appreciate that, and I didn't mean to put Amber on the spot. I
No,
just
no,
was
you're
trying to-
not. She's good.
Nope.
She's tough.
She can handle it. Thank you very much.
Any other questions?
Madam Chair, move favorable as amended.
Okay. Okay. All right, that's good.
Everybody wants.
So we have Hayes and Lamb. Okay, all in favor of House Bill 893 as amended? Is it a party? No? No. Okay, it's a unanimous vote. Thank you.
Well, look at there.
We want to go back and say the same thing you guys are saying. Cut costs for consumers.
It is, though, it was one of the top issues that consumers have.
Because you know the cost of eggs went down, right?
Yeah.
We can certainly.
And the cost of gas went up. Okay. We are going to skip 952 because there's still amendments that Amber's working on, and she's been a little busy with some other bills. We're going to go to, and we're going to skip 1191. It didn't have a cross file. We're going to skip 860 because it didn't have a cross file, and we're going to go to House Bill 624. This is on page 2, along with Senate Bill 411. This is the safe staffing bill. So, Nathan.
Yes, ma'am. So the committee has a reprint of Senate Bill 411, House Bill 624, and Senate Bill 411, should the committee choose to do so, would be amended to be identical. So I'm going to explain Senate Bill 411 and happy to answer any questions based on that reprint. So Senate Bill 411, and as shown in the reprint, requires each hospital by July 1, 2027, to establish and maintain a clinical staffing committee as specified. So if a hospital has 150 beds or fewer, the committee must consist of 3 managers from the hospital and 2 employees. If a hospital has 151 or more beds, the committee must consist of 5 managers and 4 employees. The chief nursing executive at the hospital must create a draft clinical staffing plan and then submit it to the committee to be finalized. The bill specifies factors that the committee must consider when finalizing the plan. By July 1 each year beginning in 2028, each hospital must implement a clinical staffing plan and assign personnel to each patient care unit in accordance with the plan. The plan must be provided to staff at the hospital on request. And the bill may not be construed to require a hospital to take actions that are inconsistent with the Centers for Medicare and Medicaid Services conditions of participation or accreditation standards for the accreditation body that accredits the hospital. So the amendments generally establish the size and composition of the committee, requires hospitals to comply with safe staffing standards of applicable accrediting bodies and federal bodies, and then otherwise implements the bill as I've described.
Any questions on safe staffing? If not, can I have a motion, please?
Move favorable.
Thank you, Senator Gallo. Can I have a second? Senator Lamb? All in favor of the safe staffing bill? Oh, Senator Hershey?
Quick question. Obviously, we've tried this for a few years, and I think everybody obviously agrees that we want to make sure we have the appropriate staffing at the hospitals. But is everybody kind of more on board with this now that we've made these changes?
Well, a couple of things happened. One is the federal government came out with a safe staffing requirement for accreditation, so we have to do something.
Right.
And not me, but other people in the administration have worked closely with the hospitals and the unions, and I think developed this language.
Okay,
I wasn't part of the conversations, but I've been assured that it's addressing everyone's concerns.
okay. Thank you very much.
You're welcome.
Appreciate the work.
Motion from Senator Guile and a second from Senator Lamb. Should we call the roll? Okay. Tammy, can we call the roll? Can we do House Bill, they're both amended identically, right?
Would be
Yeah, we can do them
Senate Bill
together
411 and House Bill 624, both favorable with
as
amendments.
amended.
House Bill 624 and Senate Bill 411, both favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
For now, no.
No. Senator Mouts. Yes. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey.
I appreciate the work that went into it, so I'll say yes.
Yes. Madam Chair.
Does anybody want to change their vote?
Yes.
I tell you what, I'll go yes. I just want to look at some of it a little bit more.
So you're going to go to yes?
I'll go to yes for now, maybe change it.
Unanimous.
Okay, so Nathan, next we have House Bill 1109 and
Yes.
Senate Bill 790, Public Health Reform Act. Are they in the, now you've amended them to be identical?
They would be. So the committee has a reprint of House Bill 1109, and should the committee choose to move Senate Bill 790, it would be amended to conform. So walking through, or just first describing House Bill 1109, and then I'm available to walk through it as necessary. The bill as amended and shown in the reprint reflects amendments that are being offered by Senator Lamb. Generally, the bill alters the membership, duties, leadership, and staffing of the Commission on Public Health, CPH, and then extends the commission's termination date and requires the Department of Health to provide quarterly updates on the implementation of CPH's recommendations. The CPH, in consultation with the Department of Health and the Health Services Cost Review Commission, must convene a Community Benefits Modernization Subcommittee with associated reporting requirements. The bill also requires the Department of Health to organize the Maryland Medical Reserve Corps and makes alterations to the Corps. It requires the Department of Legislative Services to develop a process to assess the health equity impact of relevant legislation, makes administrative changes relating to county health officers and local health departments. It requires MDH in consultation with local health departments to notify each health officer of certain procurements, and then requires the Department of Health to convene a work group on local health department recruitment and classification processes, and finally alters the membership of the Maryland Core Program Advisory Board. So the amendments that Senator Lamb is offering, they restore provisions authorizing a county health officer to enter into certain contracts if the Secretary of Health does not respond to a request for approval within a certain period of time. I believe that changes on page 6 of the reprint. Below line 11, and then also restores provisions establishing a certain workforce fund, and then allows for transfers of funds to that new fund that are consistent with the requirements of the AHEAD model. I think that was one of the reasons that this provision establishing the Public Health Workforce Development Fund was struck, was because of fears that it conflicted with provisions of the AHEAD model. One final thing that I wanted to point out for the committee to consider, the subcommittee report, if you're looking on the last page of the bill, is due in September of 2027, but the provisions that govern that subcommittee sunset on June 30th of 2027. So theoretically, the group would no longer exist at the time the report was due. And so that could be corrected just by moving the sunset date back to December 31st rather than June 30th of 2027 on page 17 in line 28. Just raising that for the committee's consideration.
I'm sorry, Nathan, you lost me. What do we need to do?
The date shift that I was referencing? Yeah, so on the last page of the bill, you'll see that Section 3 of this act remains effective for a period of 1 year, and at the end of June 30th, 2027, Section 3 is abrogated. Flipping back to page 16, you'll see this is where The Commission on Public Health, in consultation with the Department of Health and HSCRC, has to establish that Community Benefits Modernization Subcommittee. That report, if you look on page 17 in line 16, is due September 1st of 2027. So the problem is that that group of people are set up by a provision that would sunset before their report was due.
So how do we fix it?
On line 28, strike June 30 and substitute December 31.
Okay, so that's kind of a on-the-spot amendment.
Yes.
Okay. I was going to say, Senator Lamb, you chair the Public Health Work Group Commission right now?
I don't chair it. I'm the Senate representative to
Okay.
this, and this was, I know, a labor of love for a lot of folks that were on this commission and served for 2 years. And we took what we took was the initial lower hanging fruits out of the commission's report. To start here, I think they all recognize there's more work to be done. That's why there's some work groups that are being set up to extend kind of longevity of the committee. And this reflects kind of the work group's or the commission's priorities and products. So move favorable with the amendments.
Thank you, Senator. Can I have wait a minute. Can I have a second?
Yes.
Senator, and Senator Reedy, do you have a question?
I'm trying to understand what the cost associated with this, like what are we, I'm just trying to understand this in the broader framework of everything we're doing.
Yeah, so the fiscal and policy note explains that generally the bill's requirements can be handled by affected state agencies using existing budgeting resources.
Okay.
And I can add to that too.
Yeah, please.
There were 3 chairs of this committee because of how our committee set this up 2 years ago. Those 3 chairs have been using some of their resources from these academic centers, academic schools of public health within the state to be able to support that. There's similar provisions in here that allow for the chairs to provide staffing. So there's no staffing requirement, there's no budget requirement here. I think the piece on impacts related to health that DLS said that they would do, I think on the House side, they already cleared that with DLS and they're okay with that too. So there's no impact here. Should not be any costs.
Okay, thank you, Madam Chair.
Thank you, Senator Reedy. Do you have any other questions? Okay, we have a motion and a second. Can I ask, is this a unanimous vote on, okay, can we call the roll, Tammy, please?
Yes.
This is both bills, House Bill 1109 and Senate Bill 790.
All right, Vice Chair Hayes? Yes. Senator Kramer?
Yes.
Yes. Senator Reedy? No. Senator Mounts? No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey? No. Madam Chair?
Yes.
Yes. 7-3.
One more time, we have the double bills. It's going to be Nathan. House Bill 1151 and Senate Bill 611. Hopefully, they're going to be amended identical, and we can vote together.
That is correct. So should the committee choose to, these bills can be aligned and voted at the same time. So House Bill 1151, for which you have a reprint because there is one small amendment. House Bill 1151, as amended and shown in the reprint, requires the Maryland Healthcare Commission and Medicaid to jointly study the impact of requiring Medicaid to provide reimbursement for room and board services provided by a hospice house. By December 1st of 2026, should the committee adopt the amendment, the Maryland Department of Health must report its findings to specified committees of the General Assembly. So the amendment would delay the due date of the report from September 30th to December 1st of this year.
I thought it was a little quick that we're going
We'll take it.
it's effective July 1, and we were going to request a report by September 30th, so we took it till December. Okay? All right. Can I have a motion on?
I'll second.
Okay, so this is 2 bills together, Tammy, House Bill 1151 and Senate Bill 611. Should we call the roll? No, all in favor of the two bills we just discussed. Unanimous vote. Thank you. Okay, I'm going to do one that we didn't talk about earlier. House Bill 1367, the Commission on Reimagining Healthcare. I don't think there were any amendments. Nathan?
House Bill 1367, so there is one amendment, and it's shown in the reprint. House Bill 1367 establishes a Commission on Reimagining Healthcare to envision a comprehensive healthcare system for the state, as described in the bill. So the commission must study several issues and make recommendations regarding the establishment of a new healthcare system. The commission must submit to the governor and the General Assembly preliminary reports December 1st of 2027 and 2028, and a final report by December 1st of 2029. The Healthcare Commission must provide staff for the commission, and the bill is contingent on the Maryland Healthcare Commission determining the funding levels needed to conduct the work of the commission and then securing private funding to do so. So there is no state funds that would be involved in that effort. The amendment from Senator Kramer is found on page 3. It adds an additional member, one representative of a nonprofit that advocates for young adults with chronic health conditions transitioning to adult healthcare systems. That's the bill. There is no fiscal impact.
Any questions?
So move.
Thank you, Senator Hayes.
Sorry?
Senator Hayes and Senator Kramer, can we, do we need to do a roll call? Uh-huh.
So this requires 3 members of the Senate?
Yes, 3 members of the Senate appointed by the President and 3 members of the House appointed by the Speaker, as well as many, many other members.
Just change my vote on that one.
Madam Chair, you could offer an amendment to reduce those numbers if you'd like.
Well, I mean, I'm happy to serve on it.
There is
but
not
I
a
just wanted to
crossfire.
point that out.
One, two.
I think we should write their
You want to do 2?
Can we do that?
Yeah.
Can we do that verbally?
Yes.
I'm amending my motion to reduce it to 1 on each side.
I will tell you, it's a huge commission. No, but it is a huge commission if you've looked at all the members. Okay, so 1 and 1.
Yes, ma'am, I can do that.
All right. Can we have a vote, or do we want to call roll? Let's call the roll, Tammy, please.
All right, House Bill 1367, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy? No. No. Senator Mounts? No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile?
We're still on HB 1367.
Yes, we are.
We-
The amendment that says.
Senator Hayes' amendment?
Yes.
Yes. Senator Lamb? Yes. Senator Hershey?
No.
No. Madam Chair?
Yes.
Yes. 7-3. Bill passes.
This is going to go to page 3, please. We're going to go to House Bill 939, Delegate Rosenberg's bill. House Bill 939, Delegate Rosenberg.
There is one amendment, it's somewhat technical and requires the bill to requires the parents to notify the person required to file the certificate rather than the Division of Vital Records if the certificate is going to be filed in 10 days instead of 5.
What about their gender? Not one bell. Not one
No gender, no gender. Okay. Senator Gall, motion favorable. Do we have a second? Senator Lamb? All in favor of House Bill 939? Unanimous vote, thank you. Okay, and then we have House Bill 1081 that we did have a cross-file on. And Lisa, do you have any additional amendments to that?
Yes, so House Bill 1081 as amended was amended to conform it more with the cross-file that we had. So specifically, it strikes the provisions relating to procurement, relating to the quick take authority and the tort cap. So what's remaining is mainly the restructuring of the Baltimore Regional Transit Commission into the Board of Directors for the Core Transit Service and the Commuter Advisory Board. There are a few slight differences between the House bill and the Senate bill as this committee passed it out that are small technical changes in the reprint. So this would differ slightly from the version as we passed it.
Can we make it? Can we make it?
We can take out their amendment, sure.
Senator Hayes, do you have any comments on that? What are the differences?
So in the provision that says there's a representative of labor unions on the Core Transit Service, they added in language saying the labor union representing the plurality of frontline workers. They added a student who regularly uses administration services to commute to and from school as a non-voting member of the Core Transit Service. And there's language added to the conflict of interest provisions for the Core Transit Service to say that the conflict of interest standards are consistent with certain provisions of the general provisions article, and then saying that originally it said they could not have an inappropriate financial or non-financial interest, and this changed it to inappropriate professional, financial, or non-financial interest in a matter over which the board has jurisdiction.
So we need to find out if the House is going to amend the Senate bill, or do we know if the House amended the Senate bill?
They had asked if we were going to put those in or not.
Okay, all right. So
What is that for, 1081?
1081, that's the MTA bill.
Should we hold it?
They just
No.
keep coming with new amendments every day.
Well, you held up the big ones, though. You took care of that.
So what do you want to do here?
Okay, so House Bill 1081 as amended.
Move favorable as amended.
Yep. Second.
Okay. No longer. Should we take a vote, roll call vote? Let's take a roll call vote, just to be sure, Tammy. Thank you.
House Bill 1081 favorable with amendment. Vice Chair Hayes? Yes.
Reluctant.
No.
Senator Kramer? Yes. Yes. Senator Reedy? No. Senator Mounts? No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile?
Yes.
Yes. Senator Lamb? Yes. Senator Hershey? No. Madam Chair?
Yes.
Yes. 7-3. Bill passes.
Surprise. All right. So that takes care of the pink list. We are going to go to, do you mind if we go to 26 and do the two bills on 26? Yeah. Oh, I thought you said pass.
I thought you said pass.
But Tammy recorded, okay, okay. He said pass, and I thought I heard pass, and you said yes. No, it's fine. As it turned out, it's fine. Thank you. It's usually my hearing, that's all. So, okay. I just want to put this to rest before we go to these more complicated bills, if you don't mind. So we're going to go to voting list number 26. Number one is House Bill 672.
Did you want to do 1560? Never mind. 672. All right, House Bill 672. This bill alters the entities eligible to receive grants for conducting pediatric cancer research from the Maryland Pediatric Cancer Fund to include only nonprofit hospitals, educational institutions, and other nonprofit organizations. So laboratories and persons are no longer eligible for grants. There are no amendments. There is no fiscal impact. There was no opposition at the committee hearing.
Can I have a motion favorable, please? Senator Mounts and Senator Reedy, okay. All in favor of House Bill 672? Okay, unanimous vote. Thank you. All right, we're going to go, all the rest of these bills did not have a Senate cross file, so we're going to save some angst, and we're going to go to the last bill on the list, which is the Speaker's bill, House Bill 1563.
Yes, ma'am.
Is there any amendments?
There are no amendments, no fiscal impact, no opposition at the hearing.
Second.
Okay. Yes, sir.
Not on this bill, but as soon as we finish this bill, I have a question.
Okay. House Bill 1563.
I don't have the voting list that you all are looking at.
It's from yesterday.
It's yellow one from yesterday.
Sorry, it's a speaker one right there.
This one right here, 670.
Here.
We skipped every other except the last one.
Yeah, we skipped them all. We went to the last one.
Except the speaker one
Right.
at the end.
Right.
Can I just have a
Oh, the
reprint
vote
of mine?
in the House.
Remember at the end of the voting session yesterday, I said keep stuff on your, oh, you wasn't
Skipping
here.
all of these and then we just.
All right. So,
Not on my own.
no, 1563. So that I can, Senator Reedy, this is the yellow voting list from yesterday. The first bill off of the yellow sheet from yesterday, voting list number 26, was House Bill 672. And the chair has then asked me to explain House Bill 1563, which is the last bill on voting list number 26.
This isn't yellow, but I have.
Oh, right.
All bills that didn't have cross files. So we're waiting a
Yes.
little bit on them.
Are we still on the speakers one?
I think that,
Oh, I'm
Yes.
favorable.
I'll have you as favorable, and Senator Hayes is second. Yes. All in favor of the Speaker's bill, House Bill 1563. Okay, thank you.
Get my raised hand recorded on the.
Yeah. I should raise two of mine.
Put it on the, get it on the camera.
All right. We're on number 24 now? Okay. We're going to go to list number 24.
What color is that?
It's yellow. And we're going to get through as many of these as we can, but I think we should probably try to stop as close to 4. What time are we going back in, 5?
Yeah.
Okay. We're going to try to finish at 4:30, okay? We're going to try to finish by 4:30, okay. Again, we're going to skip a little bit, and we're going to go to Senate Bill 900, Senator Reedy. I'm sure you won't have a complaint about that, and House Bill 1016.
So these are a pair of bills that, as amended, will be identical. As amended, they prohibit enforcement of a non-compete agreement for licensed architects employed by an employer with at least 30 employees based in the state if the employer no longer maintains its principal place of business or a majority state workforce at the time of enforcement. There are 2 amendments. Amendment 1 is technical, and Amendment 2 amends the bill as specified.
Do we have any questions? Do we have a motion?
I move favorable.
Of course you would. Do I have a second? Senator Lamb? All in favor of Senate Bill 900 and House Bill 1016?
Did we do the, I'm sorry, was it architect?
Yes, that was the
Yeah.
amendment.
Okay.
Yeah,
Sorry,
for the
thank you.
architects. Okay, that's 10 to 0, right? Okay. All right, now we're going to do some local bills. Prince George's County Delegation Bill. Senator Washington, these are your county. House Bill 406.
House Bill 406 removes the prohibition against the Prince George's County Board of License Commissioners issuing multiple Class B on sale beer and wine or Class B on sale beer, wine, and liquor licenses to the same person or premises. There are no amendments, no fiscal impact, and no opposition to the committee here.
Have a motion? Thank you, Senator. Do I have a second? Senator Kramer? All in favor of Prince George's County Delegation Bill 406? Okay, unanimous vote. 443.
House Bill 443 establishes in Prince George's County a Class B SEC Small Event Center beer, wine, and liquor license and authorizes the Prince George's County Board of License Commissioners to issue the license to a small event center. The license authorizes the license holder to sell beer, wine, and liquor for on-premises consumption to individuals attending an event at the event center as described in the license. There are no amendments and no fiscal impact.
Have a motion?
Second.
All in favor of House Bill 443? Looks like a unanimous vote. Okay, we're going to skip 535. It didn't have a cross file. We're going to go to House Bill 583.
House Bill 583 clarifies the Prince George's County Board of License Commissioners must provide notice to the Director of the Department of Permitting, Inspections, and Enforcement rather than the Director of the County Department of Environmental Resources when the board issues a Class C per diem beer, wine, and liquor license. There are no amendments and no fiscal impact.
Do I have a motion? Thank you, Senator Washington. Do I have a second? Senator Reedy, was that you? Okay. All in favor? 583. All right, all good. Okay. Now we have House Bill 611. I know.
Okay.
Do you have an amendment?
Yeah, no, I have one actually. It's out of order. Let me find it.
We should do 625 too, because we have a cross file.
Okay. House Bill 611 increases the annual fees, application fees, and license transfer fees for various alcoholic beverages licenses and permits in Prince George's County. There are two amendments. Amendment 1 is technical, and Amendment 2 prohibits the board from issuing, transferring, or renewing a license or permit unless certain ownerships and operational requirements are met, and prohibits a license holder in a district other than the 23rd Legislative District from displaying advertisements or promotional materials on the exterior or windows of the licensed premises.
Okay, so I did have some calls about this one, because I think it's being requested here in the Senate. It was not part of the hearing,
I don't believe so.
and I don't know if it was part of the letter. But it's kind of a big deal to limit advertising. It's like First Amendment issue. So Senator Washington, do you know anything about that amendment?
Yes, I know a lot about them.
Okay, can you talk with us about it, please?
Sure. Our delegation voted that Class A beer, wine, and liquor licenses, Class A beer and wine licenses do not have any exterior advertisement at these locations. The issue being for decades, a lot of our liquor stores, of which we have over almost 200 of them, beer, wine stores, as well as liquor stores, nearly 200. And all of them have signs that are either been deteriorated or not properly managed or anything like that. And so we decided as a delegation that we would ban them on those stores. There was initial conversation around just banning alcohol and cigarettes, but then there was a motion by others and supported by the delegation to ban advertisement altogether. Part of the reason also, Madam Chair, is because it's hard and more difficult for the police or anyone else to see within these establishments as they're walking past or walking through if they have window signage all over the doors, the windows, and everything else. It's just cluttered, essentially, with signage. And so in our county, we've asked for this to be banned of any advertisements on the exteriors of these properties that are listed.
But it isn't on the Senate bill. It isn't on the House bill. You're just putting it on the Senate bill.
No, this House Bill 611, so it's a House bill.
There's no
But I mean, it didn't come over that way from the House. This is a new amendment, isn't it?
It's a
Yeah.
new amendment proposed by the delegation, correct?
Okay.
We all have our local delegations where one part of the delegation feels strongly about something, another part of the delegation does not. So
Okay.
they disagreed and we agreed. I mean, they haven't taken this up yet. They will still have their ability to consider it and vote for it too.
Can we hold this until they've taken it up?
No, because they won't see it until they take it up.
There's
I
no
mean,
crossfire.
you have a letter from our Senate delegation to move this amendment forward.
I just have concerns about the First Amendment with no advertising. Senator Guile?
With all due respect for George County, I do have just a quick question. I guess I'm just trying to understand, I mean, the substance of the bill just outlines like different changes in license fees. And unless I'm looking at, I mean, it just says then, at least for the amendment on advertising, it's just more of an the wherefore, right?
It just about what?
I'm trying to look at, this is this, right?
No, where's the amendment?
I see advertising restrictions. Where's the substance?
Oh, got it.
I don't see any substance regarding advertising other than the title and then for the purpose of, and then providing.
Is it on page 9? I just want to make sure, maybe.
No, I only have page 3.
I've got,
We have up to 3 of 9.
This is a fee increase bill that was supported by the House delegation.
oh, no, I hear you. I'm just saying that at least for the bill, there's no substance saying.
We're getting some more copies made.
Hold on, this is the right one.
Can I just say this? Yeah, I hear you.
That was 611. Lisa, okay.
Yeah, that got screwed up, that's why.
Okay. Amber's making copies of the.
Okay, let's hold this and move on to the next bill while copies are being made, because nobody's looking at it. I only had something online.
Yeah, I don't understand that because we voted on this last week and we sent it to the delegate, we sent it to the
Okay,
committee.
so as soon as the copies are made, we'll go back to it. I'm just trying to watch the time here. We have House Bill 625, which is a Delegate Collison bill that had a cross file, and it's Human Relevant Research Fund Collection of Contributions.
House Bill 625 requires the Maryland Department of Agriculture instead of the Maryland Department of Health to collect.
Wait a minute, I'm going to hear it.
To collect already required contributions from specified research facilities.
That's it? That's it. Okay.
There's no
We already
amendments.
voted, and it's the same.
This is identical to the
Okay,
Senate
so
cross
Senator
file.
Kramer motioned. Can I have a second? He motioned.
Gazzoni's bill.
Senator Jackson? Okay. The Senate bill was Senator Gazzoni's bill? Okay. House Bill 625 with no amendments. Do I have- We need to call a roll, Tim.
House Bill 625, favorable. Vice Chair Hayes. Yes. Senator Kramer.
Yeah.
Yes. Senator Reedy. No. Senator Mounts. No. Senator Jackson. Yes. Senator Washington. Pass. Senator Guile.
I'm sorry, which?
House Bill 625.
Same posture as the Senate bill we passed.
Yes.
Yes. Senator Guile, yes. Senator Lamb. Yes. Senator Hershey. No. Senator Washington. Yes. Madam Chair.
Yes.
Yes. 7-3.
All right. Do we have the copies yet? Not yet.
There were.
Okay. Lisa, you said 684 was in the same posture as Senate Bill 521, even though they don't show the
Yes.
cross files. We passed Senate Bill 521 with amendments or without amendments?
Senate Bill 521, I think, just had some technical amendments to conform it to this bill, and it passed unanimously in the Senate.
Okay. So Senate Bill 521 passed unanimously. House Bill 684 is a cross file, not listed as a cross file. Can I have a motion for House Bill 684? Senator Hayes, are you raising your hand?
Just favorable.
Favorable with amendments.
No, this one doesn't have
Oh,
amendments.
this is
Sorry,
amendment. The Senate bill you meant. Okay, Senator Reedy, okay. Clearly state it for me again, because I think I just confused some people.
So this bill does not have any amendments, but it is conformed to Senate Bill 521 that we did amend to conform
Okay,
slightly
So if Senate Bill 521 was conformed
to this bill.
House Bill 684, okay. All in favor of House Bill 684? Is that a yes? Okay. And then House Bill 811 is the cross-file of Senate Bill 530, and what was that? How did that go?
That one was voted out by the Senate unanimously. There's one amendment that's technical and corrects a drafting error. There was a "the" in the title of the House bill that was not there in the Senate bill.
Okay,
So we were just striking that.
so we're correcting that. So now it's the same.
Now they're identical.
So we passed Senate Bill unanimously, and we're going to now pass House Bill 811.
Favorable.
Thank you, Senator Kramer. Who's second? Senator Lamb. All in favor of House Bill 811? Unanimous vote. Thank you. All right. Now we're going to House Bill 1091, Delegate Kerr's bill, which had a cross-file 813.
Yep, and the cross-file of that passed unanimously. This bill expands provisions of law governing the assignment of benefits under certain health insurance policy. There are no amendments.
Okay. Senator Reedy said favorable. Who's the second? Senator Mounts? Okay, all in favor of House Bill 1091? Unanimous vote, okay. How about House Bill 1387, which is cross-file of Senate Bill 637?
Yep, this is another one where the cross-file passed the Senate unanimously, and this reduces the minimum commission rate for MAIF to pay an insurance producer from 10% to 5%. It prohibits MAIF from paying a commission on a policy written directly, and it's identical to 637, which passed the Senate unanimously. There are no amendments.
Motion on House Bill 1387, identical to 637. Senator Jackson? Senator Jackson, can I have your favorable motion on this bill that you had the Senate bill, House Bill 1387? Yes, ma'am. Okay, can I have a second?
Second.
Senator Kramer? All in favor of House Bill 1387? Unanimous vote, okay. Let's do Delegate Clippinger. We're going to go back to the Prince George's County bill as soon as we finish these last two. Delegate Clippinger's bill, which is Baltimore City revisions. You okay with this one, Senator Hayes? He did. Are you a second, Senator Kramer? Okay. Baltimore City bill on revisions. All in favor? Okay. And then the last one is Delegate Shetty's bill, 1490, Family Investment Program, temporary cash assistance, good cause and adequate reasons, exceptions. Lisa, you want to tell us a little bit about that, because we did not have a cross-file on that one.
Yeah, so this bill, currently for temporary cash assistance, people have to apply for child support in order to receive cash assistance, and this is allowing certain good cause exceptions in certain circumstances where an individual might not want to pursue that, such as if there's a domestic issue or if the parents had worked out something separately on their own, if the child's a product of rape or incest, and situations like that.
Do I have a motion on House Bill 1490? Senator Mounts? Okay. Do I have a second?
Second.
Senator Guile. All in favor of Delegate Shetty's House Bill 1490? We okay? Okay. All right. We are going to go back to House Bill 611, the Prince George's County Delegation Bill.
Except for the one they opposed.
Yes, ma'am. Madam Chair. Never. I never want that job.
We know you're out of here. So, I was looking at, I know we just got 611, but I didn't see the full amendments or bills for 406, 443, or 583 in our packets, and I wondered if we just missed those.
I'm sorry, which ones you asking
The other
about?
Prince George's bills we voted on. I know you guys were really concerned about seeing this amendment, so I haven't seen the other ones in our packets unless you guys delivered them already.
Do we have amendments on those?
We didn't have amendments
We
for
didn't have
those, so
amendments.
we didn't print those out.
You didn't print so you don't print out bills.
We usually, if
Just
there's like an
they're
amendment
reprint.
that's more complicated, we'll print out the reprints, but otherwise, no.
Okay.
Okay. So this little bill with the fines turned into, it went from 3 pages to 9 pages?
No, I just printed it out wrong apparently, but on page 9. Yeah, and the amendment language begins on page 9 and then continues for the next 3 pages.
Okay. So will you say that again, Lisa, please?
That the amendment, the language from the amendments begins on page 9 and then continues for the next 3 pages.
Well, the original bill is all of the fee changes, right? Mm-hmm. Okay. And that goes through page 5, page 6, page 6, okay. Page 7,
Page
boy, lots of
9.
fee changes.
Yeah.
Page 8, okay. And so now this amendment starts on page 9, okay. So Senator Washington, now that we have this in front of us, you want to explain it? Now that we can look at it?
Should I explain or should it, is it
Would you like-
typical?
okay.
Yeah.
Lisa, can you explain it?
Sure. So the first section, the 26-1609, this is not the advertising one. This is a different amendment. And this is about requirements for the board to issue, transfer, or renew a license, and says that there need to be certain disclosures about a beneficial owner. And then going on to the next page, the 26-2709 is where the advertising prohibition is put into statute. And then on the following page is uncodified language, putting in a study.
What's the part does not apply to certain premises?
It does not apply in the 23rd Legislative District.
So is that where the disagreement is in your?
No, I think there's on section B of 262709. I'm not sure who wrote this amendment, but this isn't what we agreed to in the delegation. So I'm glad we're seeing this because it should say the licenses that we're referring to, which is the typical liquor stores, Madam Chair, which are like the Class A beer, wine, liquor, Class A beer, wine, and then Class D beer, wine, as beer and light
Can
wines.
you get this amendment corrected and bring it back to us? We'll vote again tomorrow.
Sure.
Okay.
I mean, can we ask any other questions folks may have at this moment, just so that we can get this out the way?
I just know what somebody sent me, so that may address some of it. Like, this is for just those stores, not, so like a big, for example, casino, this doesn't apply to, right? I'm not saying that you asked, I'm just as an example.
I wonder what casino you're referring to.
No, I mean, or a big spherical object. No. And this is a local bill, so I'm not trying to be like, I'm not trying to do the thing where we start questioning local bills. The advertising issue, we just would probably want to make it clear, since we're amending the bill anyway, that it's just like materials on the windows.
Correct, the exterior.
That it doesn't apply to signage, like for the business, which I know is not the intent, but.
Yeah, honestly, this is not what we agreed to in delegation, and this wasn't what was written to us in delegation either. Like, this came, I don't know who wrote this, and we asked for Class A beer, wine, liquor, Class B beer, B plus beer, wine, and liquor, and Class D beer and wine, because those are just the beer and wine
Class D?
establishments. Class Ds are beer, wine, beer and light wine.
So these are all
off sale.
carry out, or they?
Yeah, these are for off sale
Package.
Off sale, yeah, off sale.
I'm totally sympathetic to the point you're making, so yeah.
Yeah, I mean, again, this is about, for the delegation, for us that has experienced these, I mean, we've seen it where they just everywhere on these windows and you can't see inside. And our police department has brought it up to us many times about how they can't see inside these establishments and how they're just, not, obviously our residents have told us it's unsightly. They don't want to see these in their nice new restaurants and things of that nature. In their liquor stores, they don't want to see this in their communities.
They're all different. Your Class A are just.
Our liquor stores, our Class is different. It's a lot of Class A. So to be specific, we have 142 Class A beer, wine, and liquor.
Okay.
Then we have a Class B plus beer, wine, and liquor. And then we have Class Ds, which are beer and wine stores.
So it wouldn't apply, like someone asked about the casino, it wouldn't apply to a winery?
It wouldn't apply to a winery, it wouldn't apply to a casino, it wouldn't apply to our typical restaurants.
Okay.
that want to advertise, it will just apply to our typical liquor stores or beer and wine stores that sell off-site, because they're typically the ones that are putting all these advertisements on all of their windows and each and every one of their doors.
Senator, was there any consideration, like we did with cannabis, to limit the coverage of the sign? Like you could say, I don't know, so many inches, so many square inches like we did in cannabis, so they can't fill a whole window?
No, there was, the discussion was around what was advertised. And then because initially it was discussed to have only beer and wine. And then there was an addition of cigarettes or anything else they sell there. But then there was a motion by the Senate President Pro Tem to just ban all of them altogether.
Okay, okay. All right, so you're going to make sure we get a corrected amendment?
Yeah, again, this isn't what we agreed to in our delegation. Our intent was only we don't want to ban things that the casino is doing or restaurants that they're doing for advertisements. I mean, those are different locations and different spaces.
Okay.
We only want to talk about the almost 200 stores that exist in our communities.
And they could still have like a sign that says John's Liquor Store.
Correct.
They just
exactly.
can't fill the windows.
Exactly. So they can advertise themselves, however they want. They just can't put any advertisement on their windows. So if they need to say who they are, that's perfectly fine.
So let's start with Senator Guile.
Thank you, Madam Chair. And I mean, I understand, yeah, some of it can be pretty excessive looking. But I guess I'm understanding, maybe Lisa, if you can help me understand. So where it says a license holder may not display any form of advertisement or promotional material on the exterior of the licensed premises or on the windows of the licensed premises. I mean, but that doesn't sound like we were just talking about like covering up the windows. When you say any form of advertisement, what does the name of the store, does anything else? Does that potentially, like, I mean, is advertisement defined, or is that, I don't know.
Just answer that question.
We did, but it's not defined in the bill.
We just talked about we're going to get an amendment to clarify.
Oh, you're going to get an amendment to clarify that?
Correct.
Okay. I didn't hear that. I thought you were getting an amendment to clarify as far as like the classes of, when you said you don't want it to cover the like casino or whatever. I thought that was more the question of who was the class, whatever license holder.
Correct.
But you're going to clarify with specificity the advertisement, the form of advertisement. Okay.
Well, we can have a discussion on that. Go ahead, keep going.
No, I mean, that's really what my question is. I wonder if, like, I mean, I understand the spirit and intent of, you know, what you're wanting to accomplish. I just don't know. I just worry that might be, maybe that could help with some clarity as far as what any form of advertisement means. Does that mean like I said, the name of the store, or like what else? Like if they're, I don't know if they're. If you don't want it covering the whole windows and everything else, that's one thing, but like, what
Like
can they do?
my liquor store, my local one, will put up signs about events coming up. They do community events. Would that be allowed? Would lottery advertisement be allowed?
Would an advertisement for a local golf event, is that what you said, Madam Chair?
No, they do all kind of community events. They'll put up like a community fair that's coming, or a bingo, you know.
We don't have those in our county, Madam Chair.
You don't have
They don't do those in our.
They don't do nonprofit fundraisers in your county?
No, they don't, no.
Really?
No, we live in two different counties.
Well, we sure do. Senator Hershey?
Thank you, Madam Chair. I was just concerned with the same things about what the extent of this advertisement is. And again, if we're going to get clarification on that, I think it's important. I mean, I know a lot of liquor stores are also delis, for instance. So could they advertise? Don't you guys have those? I guess we live in different places. Maybe every deli I go to sells beer too, but you know, I don't know. Golly. I don't know. Where else would I eat if they didn't have? Obviously, if I go to Prince George's County, I won't know what I can get if I go inside. So I think.
No, not Subway. That's why I go to the liquor store. Thank you, Madam Chair. Thank you.
That's it? Senator Kramer?
Look, I get it. It's Prince George's County. God bless you. All do what you want. But just quick question. Would this also prohibit, when they get a deal with, and this often happens, they get a special on Miller Lite by the case, and they may put up a sign in the window that says Miller Lite with a dollar amount, that says $13.99 a case special. Are those signs out as well?
That's what we're looking to ban, yes.
It would be.
Yeah.
Okay.
That's the intent. The intent is to ban the advertisements of what we initially thought was the alcohol, tobacco, any of those types of advertisements that are on the exterior of properties, because they get to an extent where they're in they're in the parking lots. They're on each pole in the parking lot. They're on the windows. They're on the side of the buildings that don't necessarily have a window. They're on the back of the window. They're through the drive-through of the window. We've seen them everywhere. I mean, you can't get away from them, and I think they're unsightly. Well, our delegation believes they're unsightly and that they should not exist anymore. We're beyond that, and that's something that's that we would like to stop in our communities. If we're going to have them, we're going to have them, but we just don't want the advertisement.
Did you hear from any of your store owners? Probably not good things, right?
I'm sure they all love this.
I'm sure.
Correct. Hey, look, this is a local delegation bill. We worked really hard on it. It's something that we all have supported, and we hope that this committee will move forward and respect the local delegation's
Well,
ability.
we will look forward to your amended amendment. How's that? Thank you.
Madam Chair, honestly, I wish I would have saw this before, because I would have caught that. And so if I could, I don't know how it works, because in our delegation, we had a committee council that was writing these amendments. I'm not sure what they sent to Lisa or the committee staff here. So I would like to see what's the next steps in getting that done, because I don't know the process here
Okay.
in the committee to get that done.
Yeah, I can talk to you
Lisa.
after
Okay.
the hearing.
All right, Senator?
Yeah, for the senator, regulating commercial speech is really tricky. Did you talk to the Attorney General's office about the proposed the regulation, like trying to do this in law? Because it's commercial speech. I'm going to vote for it. I'm going to support you. I just know regulating commercial speech is tricky. Tobacco, you've got a targeted interest, and that's how the tobacco regulations and advertisement, how they took place. That took a number of years and a lot of litigation. And there's some very specific things you can do and you can't do with commercial speech. I'm going to vote for it and support you, but I wouldn't want to vote. I would hate to see it do a bill and then have a lawsuit, because if it does infringe on commercial speech, I would expect just the general business community to step in. So it's not just those particular stores. So I was just looking on Google. It kind of lays out. I know Google isn't always right, but it gives you some specifics. So and I did okay in my con law class, but I wasn't the top. But so.
In response to that, thank you for your support for this bill. We've regulated signage and advertisement when it comes to other industries here in this committee. So I don't think it'd be any different from those, because those are commercial as well.
Okay, I don't see any other questions. It is 4:10. You were due on the floor at 5 o'clock. Thank you very much.
What a way to end.
I'm supposed to remind you about our committee photo is tomorrow morning at 9:45. Senator, did you hear that?